Welcome everybody. In this video, we are going to look at the concept of preconception nutrition. And by the end of this lecture, I expect the students to have understood and be able to explain the concept of preconception and periconception nutrition, reproductive physiology, the factors that contribute to reduced fertility in men and women, nutrition during preconception period, and the nutritional and non-nutritional factors that reduce fertility. Adequate health and nutrition status are very important for successful reproduction. And in the same way, inadequate health and nutrition status may disrupt reproductive capacity. Let's look at some important terms that we are going to encounter in this lecture. Fertility. This refers to the actual production of children. Fecundity addresses the biological capacity to bear children. Infertility is the lack of conception after 1 year of unprotected intercourse. And subfertility refers to reduced level of fertility characterized by unusually long time to conception, over 12 months, or repeated early pregnancy losses. Preconception overview. Infertility. Research has it that about 15% of all couples are infertile, and 44% of couples diagnosed as infertile will eventually conceive without the use of technology. And healthy couples have about 20 to 25% chance of conception within a given menstrual cycle. Miscarriage refers to the loss of a conceptus in the first 20 weeks of pregnancy. And there are various causes of miscarriages. For example, a defect in the fetus, maternal infections, structural abnormalities of the uterus. Some women have abnormally small uteri that cannot be able to hold the pregnancy. And then endocrine or immunological disturbances. Subfertility, as earlier on mentioned, refers to reduced level of fertility characterized by unusually long time for conception. And it is known that about 18% of couples are subfertile. And some of the factors that may consider someone being subfertile are having multiple miscarriages. If a woman miscarries continuously, then she might be termed as subfertile. Then sperm abnormalities. Some men have immotile sperm. They cannot be able to swim well. Others have no tails. So there are many dysfunctions in the sperms that may cause subfertility. Infrequent ovulation. Some women may not ovulate. And even some may have their periods but are not able to ovulate. And those are anovulatory cycles. And this is a contributor to subfertility. Let's briefly look at reproductive physiology. Some of the key terms we are going to encounter are puberty, and this refers to the period in which humans become biologically capable of reproduction. The ova refers to the eggs that females produce and store within the ovaries. The menstrual cycle is basically a 4-week interval in which hormones direct the buildup of blood and nutrient stores within the uterus. And during this time, the ova matures and then is released. So failure of this ova to be fertilized will cause the built-up blood and nutrients to break down. And this is evidenced in the monthly flow in women. The development of female and male reproductive system begins during the first months after conception, and this continues to grow and develop throughout the period of puberty. The capacity for reproduction basically establishes during puberty when hormonal changes stimulate maturation of the reproductive system in both the men and the women. Ova and women. Women born with a lifetime of about 7 million immature ova. That is the amount of ova that any woman is born with, about 7 million immature ova. But during her fertile years, you find that about 400 to 500 ova will mature and be released. And also the quality of the eggs produced decreases with age due to damage of cells' DNA from various factors in the environment. The sperm and men. Sperm production basically begins during puberty and decreases somewhat after the age of 35, with a production that continues to up to old age. So there is no menopause for men, but the amount of sperms produced with years decreases as a man ages from about 35 years. So this is basically the female reproductive system, and this diagram is showing you the different parts of the reproductive system of females. And this is the male reproductive system and the different parts. Hormonal effects during the menstrual cycle. So let's basically look at some of the hormones that are released during the whole of the menstrual cycle. Gonadotropin releasing hormone, GnRH. This hormone stimulates the pituitary gland to release follicle stimulating hormone and luteinizing hormone. The follicle stimulating hormone stimulates the maturation of ovum and sperm, and also the production of estrogen. Luteinizing hormone stimulates secretion of progesterone and testosterone. Estrogen stimulates the release of gonadotropin-releasing hormone in the follicular phase and follicle growth and maturation of the follicles. It also stimulates vascularity and storage of glycogen and other nutrients within the uterus. Progesterone prepares the uterus for fertilized ovum and also increases vascularity of the endometrium and stimulates cell division of the fertilized ova. So there are two main phases of the menstrual cycle. We have the follicular phase and the luteal phase. The follicular phase is the first half of the menstrual cycle. During this time, follicles grow and mature, and the main active hormones are gonadotropin-releasing hormone, follicle-stimulating hormones, estrogen, and progesterone. In the luteal phase, this is the second half and the last half of the menstrual cycle. It occurs after ovulation, that usually occurs about the 14th to 15th day, depending on how long your period may be. During this time, formation of the corpus luteum takes place, and then also the presence of estrogen and progesterone stimulates the menstrual flow. And then prostaglandins are also released and cramps are experienced during this time. The male reproductive system is mainly an interaction of the hypothalamus, the pituitary gland, and the testes that encompasses the whole of the male reproductive physiology. And the process is ongoing rather than cyclic. Sperms are stored in the epididymis and then released in the semen. Sources of disruptions in fertility. There are some factors that may cause disruptions in the fertile cycles of both men and women, and some of these include adverse nutritional exposure, contraceptive use, severe stress, infection, tubal damage or other structural damage, chromosomal damage. So let's look at some of these factors in this table. There are factors that will affect both men and women. There are factors that are specific to only females, and there are those that are specific to men. So the factors that affect both men and women include weight loss of over 10 to 15% of the normal weight, inadequate antioxidant status, for example, selenium, vitamin C, and vitamin E. Lack of these antioxidants will increase oxidative stress that cannot be controlled due to the absence of these antioxidants. And the oxidative stress leads to damage of the cell's DNA and hence reducing fertility. Inadequate fat. Most of the hormones, reproductive hormones, are made up of fat. They are steroid in nature, and they require a lot of fats for their synthesis. So if the body does not have enough fat, definitely there is going to be subfertility or altered fertility. Excessive body fat, especially central fat, also contributes to altered fertility. Extreme levels of exercise. This causes depletion of energy and fats and also other nutrients, and the end result is the body becomes compromised of some nutrients. Exercise is good, but too much of it becomes unhealthy for the body. High alcohol intake. Alcohol is dangerous, especially to women of reproductive age and also to pregnant women. So continuous consumption of this alcohol can damage the cells and certain parts of the reproductive system and hence altering fertility. Endocrine disorders, for example, hypothyroidism and Cushing's disease. Structural abnormalities of the reproductive tract. As I earlier said, there are some women whose uteri are abnormally small and they are not able to hold a pregnancy. Chromosomal abnormalities in the sperms and eggs. There are some sperms that are malformed, some are not able to swim, others do not have tails. So these abnormalities may cause altered fertility. Celiac disease, oxidative stress, severe psychological stress, infection, sexually transmitted diseases, and then some chronic conditions, for example, diabetes, cancer, and other disorders. There are some medications that may also alter the fertile cycle. The factors that are specific to only females include recent oral contraceptive use, especially within 2 months, anorexia nervosa and bulimia nervosa. Anorexia nervosa is characterized by reduced appetite and extremely small body, excessive weight loss. And bulimia nervosa is characterized by binge eating that leads to obesity. Vegan diets may also cause altered fertility because there are some nutrients that are only obtained in animal foods. So a person who consumes only plant foods will be at risk of deficiency of some of these nutrients that may contribute to altered fertility. Pelvic inflammatory disease, endometriosis, polycystic ovarian syndrome, poor iron stores, and high fiber diet. In males, we have inadequate zinc status, heavy metal exposure, for example, lead, mercury, cadmium, and manganese, halogens in some pesticides, and glycol in antifreeze, de-icers exposure, estrogen exposure in DDT and PCBs, sperm defects. You find that the sperms have abnormalities in quality and also motility. Some of them are not able to swim adequately. Excessive heat to testis, then steroid abuse and high intake of soy foods. So all these factors together may lead to altered fertility. It's not only one single factor that acts, but it is a combination of factors that may cause altered fertility. Nutrition-related disruptions in fertility include undernutrition, weight loss, obesity, high exercise levels, and also intake of specific foods and food components. Let's look at undernutrition and its relation to fertility. Undernutrition in women that were previously well nourished will cause reduced fertility. And this is associated with a dramatic decline in fertility that usually recovers when food intake also recovers. And food shortages in countries have been accompanied by dramatic declines in birth rates. For example, in the context of South Sudan, you find that the rate of fertility is reduced in most of the population due to the continuous experiences of drought and famine that is exacerbated by the wars and conflicts. Long-term or chronic undernutrition may reduce fertility by only a small amount. And the primary effect of chronic undernutrition is the birth of small and frail infants. And there's also a high likelihood of death in the first year of life. And then we have the short-term or acute. This one clearly decreases fertility. and this is associated with periods of fasts and famine. Body fat. There is also decreased fertility in members of the population that have very low body fat or very high body fats, because this leads to alterations in hormone levels. Estrogen and leptin. The levels of these hormones are increased with high body fat, and they also decrease with low body fat because they are basically synthesized by fats. And infertility is lower with a BMI of less than 20 or greater than 30. A weight loss of greater than 10 to 15% of the usual weight decreases the hormone levels of estrogen, luteinizing hormone, and follicle-stimulating hormone, and this may result into amenorrhea, anovulatory cycles, and short or absent luteal phases. And the treatment with fertility drug Clomid may not be effective in the underweight women. Studies from the World War II showed a 50% decrease in male fertility during the periods of starvation, and also sperm viability and motility decreased with a weight of 10 to 15% below the normal. And this also ceased at a weight loss that was exceeding 25% of normal. You find that 10 to 15% may cause subfertility. This fertility may be regained when also food intake increases and body weight also increases. But when it goes beyond 25%, it may cause a cessation in fertility. It causes infertility. Oxidative stress and antioxidant status. Oxidative stress in men is associated with decreased sperm motility and also reduced ability of the sperm to fuse with an egg. You find that the sperms are weak due to damage from the oxidative stress and the reactive oxygen species. The damage to the DNA causes the sperms to be less motile and to be malformed. In women, the oxidative stress will harm the eggs and the follicular development. It will also interfere with corpus luteum function and implantation of the egg. Antioxidants include vitamin E, vitamin C, beta-carotene, and selenium. And these are found in vegetables and fruits. And their major function is to protect cells of the reproductive system, including the eggs and sperm, from oxidative damage. Supplemental intakes of vitamin E and selenium improve sperm quality in the infertile men. And also regular intake of vitamin C, vitamin E, and beta-carotene supplements have been related to increased sperm number and motility. Zinc status and fertility in men. Zinc plays an important role in the reduction of oxidative stress, in sperm maturation, and also in the synthesis of testosterone. So a man who is deficient of zinc is going to be subfertile, and chronic deficiency will lead to infertility. So lower zinc status in men is related to poorer sperm quality, sperm concentrations, and also abnormal sperm shapes. And this will cause a problem in fertility. Folate status prior to conception and neurotube defects. Inadequate folate very early in pregnancy can cause neurotube defects. This is due to the fact that the sperm develops during the first 21 days after conception. And this happens usually before many women even know that they are pregnant, or well, before even prenatal care begins. So it's very important for a woman who is preparing to become pregnant to start taking folic acid supplements, or start consuming foods that are very rich in folate, such as the brightly colored fruits and vegetables. And intake by women of multivitamins with folate is associated with a decline in the ovulatory infertility. So you find that the problem of infertility resolves with a high intake of multivitamins that have folate. And also intake by men of multivitamins with folate is associated with improved sperm counts, sperm motility, and also decreased abnormal forms of sperm. Plant foods and fertility. Plant foods have low fat and high fiber, and this is linked to an irregular menstrual cycle. Isoflavones found in soy decrease the levels of estradiol or estrogen, and then progesterone and luteinizing hormone. And this is also related to reduced sperm counts in men and the 1-day increase in the menstrual cycle length in women. Iron status. The rate of infertility is lower in women who use iron supplements or iron from plant foods. Low iron stores and frank deficiency are common among the women of childbearing age, and this interferes with ovulation and may result in preterm delivery. So it's important to consume foods that are rich in iron in order to increase the fertility rate. Caffeine and fertility. Study results have been mixed on the effects of caffeine. Some studies show that there is increased time to conception, and others have failed to find any effects. So it is upon an individual to choose either to cut back on caffeinated beverages or to continue consuming them. Alcohol has also been shown to decrease the estrogen and testosterone levels and also disrupt the menstrual cycles. Heavy metal exposure. High lead levels decrease the sperm production. They cause abnormal motility of the sperm and also abnormal shapes of the sperm. And the buildup of cadmium, molybdenum, manganese, boron, and other metals also affects male fertility. Exercise. Adverse effects of intense physical activity include delayed age at puberty and lack of menstrual cycles. And it appears to result from hormonal and metabolic changes, which are related to chronic deficiencies, chronic caloric deficits, and then reduced levels of estrogen and low levels of body fat. And there's also decreased bone density in people who do excessive exercise. So all these factors together may cause infertility in one way or another. And if some of these problems are prevented by intake of healthy diets and moderating physical activity and intake of some drugs, the problem of infertility may be able to resolve. Thank you.